there, Deborah. Can you hear us?
Yes, I can.
Okay, great.
Hi there, Corey.
Hi.
Thank you for your interest in this
Yeah,
field.
we're fascinated by it. We got lots of questions for you today.
Good, good. I'm happy to answer questions. I'd rather answer questions than anything else.
Oh, good.
Yeah, awesome.
Mhm.
Yeah, so you're our second interview so far. We're just starting this podcast called That CBD Kitty. It's mainly going to be focused on CBD for pets, but we want to get all of the perspectives about humans first because that's where the research started, certainly.
Yeah. Okay.
And we really want to get the word out about CBD and its various non-THC components for various ailments and see if we can be an additional voice in educating people. So that's why we're doing this.
Excellent. It's really helpful because CBD, since it's connected with marijuana, has had a negative reputation, even though it is not a psychotropic. So there's no real psychotropic effects, except maybe a relaxation effect that you might get from using cannabinoids or CBD. So its benefits are amazing without what they call the high or the psychotropic part of marijuana.
Right.
In the medical community now, they're using cannabinoids as the terminology versus marijuana, just to make it clear that it is not the same as ingesting marijuana.
Yeah, I feel like that's a really helpful tool because there's such a large area of information with the product, both products, that there really isn't a differentiation too much. I feel like with the language.
Hemp has been the primary product that has been the source for CBD. And to my knowledge, I don't believe hemp has any THC in it. A hemp plant is definitely a source that is allowed to be grown and has no THC effect. There might be like a 0.0001% THC in it.
Yeah, I believe it's 0.03. This is just what I came across. And then I heard that somebody actually invented one that was 0, but that's here nor there. I was just curious if you had come across that information.
I haven't.
Yeah.
And
Okay.
I do know that the 0.03 is not a concern as far as to the law goes, as far as the THC aspect.
Yeah, it makes it completely legal at that rate.
Yes. And the reason that THC is in there at all, one thing, it's a whole plant. So there is THC and CBD in a marijuana plant. And then, like I said, the hemp plant has just so minuscule amount of THC in it. But the value of that is that the effect of CBD does seem to be enhanced with just a minute amount of THC.
Oh, it's like synergistically.
Yes, it is. And there is a benefit to having just that minute amount of THC in the product.
Of course it is. It's Mother Nature, right? That lady knows what she's doing.
Yes, the interesting thing to me is that there are all these endocannabinoid receptors in our body and in the body of animals. And it's just a beautiful thing to me to think that's available as a means of caring for our body with the use of CBD and THC.
Yeah, it's fascinating. I think I already see that we're going to do a follow-up interview with you because I want to go look at the pictures of how that system looks in both the plant and the human body. And I bet that's just going to be a whole separate interview on itself.
Yeah, it is interesting, and they're learning more every day.
I love it.
The interesting things they're doing is with CBD, which is the kind of the component of the marijuana plant that we're familiar with and that we're talking about. They have found subgroups now that are more specific for different issues in the body. There is CBN, CBG, there's A and CBC now. They're really honing in on the CBD molecule to find the variations that are helping people in different ways. For example, CBN is an anti-anxiety component of CBD. And C has recently been isolated, and that is a mood elevator. So
Mm.
then you can look at the specifics of what you might need for your pet, for example, that has anxiety, and be able to hone in and go, okay, I'll get a CBD product that has CBN in it to help with the anxiety component that my dog experiences, or the pain component with the CBD itself. So that is some research that's really coming to the fore now, and it's so exciting. A lot of it has to do when the plant is harvested, because as the plant matures, the components actually change in terms of what comes to the fore as the most effective part of the plant. For example, CBD starts out as CBG, which they call the grandfather of CBD, or the grandmother. And so that's first in the growth of the plant. Then CBD becomes more, what is the word I want to use? More focused, or the center of the plant. And then as the plant ages and matures, then the CB and CBC become more prevalent. It's also a maturation process. So that's so fascinating too.
Yes, it's like a compounding pharmacy in a plant.
Yeah, exactly. That's a way to look at it.
That's lovely. All right, we are going to hone back in on kind of the basics as an introduction to, I guess, the mission that not only to educate ourselves, but everybody else that will join us. So my first question is, how long have you been in the business and how did you get into it?
I have been working with Sandra, who initially approached me about using my licensure in Washington State to provide medical marijuana authorizations. And I felt that it was a valuable thing to do. So we started back about 13 years ago doing this project. And it has grown in terms of, actually, my clients teach me a lot too, because as over the time, people are learning more and taking more control of their own, growing their own medicine. And I learn a lot from them, as well as many medical journals and courses as I can get my hands on. So it first started as I knew that it was helpful. And I knew the main way it was helpful was to help people get off opioids. And as the opioid crisis became the topic of conversation in the United States, I saw how people weren't using the opioids. If they were using marijuana or cannabis, they were not using opioids anymore. And to me, that was amazing, just amazing that people could get off this heavy duty drug and find relief in such a positive way with just using herbs or Mother Nature's medicine.
Mm-hmm.
So that kept me going. That gave me more focus. And it took me a while to be comfortable with that role. I worked as a midwife for many years. And so I used herbs a lot versus using drugs for people's whatever might be happening for them that they needed help with. And so I did have a good solid foundation in herbology and really the confidence that can heal. And so it was just a step to go into the medical marijuana, or now they're calling it the cannabis field, to start helping people in that way. And it's just gotten better for me as I know interaction with my clients. They teach me things. There's becoming so many different ways of using cannabis out there that don't require smoking, which is not good for your throat. People are transitioning over to those other ways of using cannabis. And for pets particularly, that's good news.
Yes. Yeah. I have a lot of experience with that. Almost 2 years now. My cat suffered from seizures and I've been able to keep them at bay for almost probably a year and a half now. So my second question will be, why has CBD become more popular over the years?
I would say the number one benefit with CBD is exactly what your cat is experiencing, which is seizure reduction. And that is actually where medical cannabis got started, was Charlotte's Web, which was a little girl named Charlotte who had about 35 seizures a day.
Oh my
And
God.
their mother finally gave up on everything else that they were trying to do because nothing was working. She gave her daughter 1 dose of CBD, and I don't remember what that dosage was at this time. It was
Wow.
a giant dose. It was maybe 25 milligrams. And she went down to 2 seizures a day.
Holy crap.
So the neurologists are 100% on the side of the use of CBD, cannabis CBD, for seizure control. It really works. And another huge benefit that I see, and I use CBD on my large German Shepherd dog every day as well. So I do have some pet experience as well for pain. And it's works so beautifully for animals that their joints are sore or their muscles, or they've had some tendon or ligament problems and arthritis, old age, basically. So those are the 2 really huge benefits I see with CBD in my work.
Wow. That's
it does-
amazing. Yeah.
The other thing that people benefit from CBD with is anxiety and depression. Those currently are not listed as conditions that I can authorize the use of medical marijuana for. PTSD is, and it has helped as well.
Oh, wow.
PTSD.
Oh,
It's
wow. So interesting.
PTSD people get huge benefits. It is largely the THC component of
Oh, okay. Okay.
the PTSD
Yeah.
versus the CBD, but the CBD is good for calming nerves and anxiety. That's why it works for seizure control. It just calms the body.
Okay. So you personally are facilitating people with seizures?
Yes, only in conjunction with their physician. The way that the law is set up in Washington State, I have been vetted to make sure that I'm following all the rules I'm supposed to with the state of Washington in terms of authorizing the use of medical marijuana. And there are about 12 conditions that qualify a person to be able to use marijuana, such as cancer, HIV, chronic pain, intractable pain, which I think all of us have there somewhere, and hepatitis, Crohn's disease, any illness that causes nausea or cramping or spasms. So it's quite a range of
Wow.
conditions, but one has to have documentation of that from their primary care provider or specialist medical records before we can actually do the authorization. That's really the only qualification, is that they have a condition that would qualify for them under the state RCWs.
Wow. It's like a chronic condition that's been already
Yeah.
documented before. Are any insurance companies covering?
No, the state
Wow.
doesn't, the insurance doesn't, the feds don't, nobody does.
Terrible.
Yeah.
Okay. That just gives you authority and legal protection. Is that the whole point of them?
The authorization has several different valuable uses, and one of them is transparency with the police or their employers
Oh,
or the court.
right. If
and
they're
then
being accused of actually using marijuana products versus CBD or whatever.
Yeah, they find UA and they've got THC in there, and they have to know that.
The urinary.
Yeah.
Before we get too far, because I wanted to make sure to ask you, what did you get your license in?
My original license is as a RN, then licensed midwife, and that was my main occupation for most of my life, delivering babies for about 30 years. And then I advanced to advanced registered nurse practitioner in women's health.
Wow.
And from my interest in alternatives was always there. And so it was just a natural progression to interest in medical marijuana.
That is fabulous. Wow, what a great journey.
Yeah.
You're helping a lot of people.
That is the feedback we get. And that
Mhm.
keeps going for sure. Right now, there's only, I think, about, and I'm not exactly sure about this, about 4 authorizers in the state of Washington right now.
Oh my gosh.
I authorize as far away as Spokane and Aberdeen, and
Well, we might have to hit the road and do
Find the others.
Yeah, we have to do an international.
Right.
Yeah.
You're so few and far between.
Yeah.
We have to find them all.
Yeah, we gotta make sure everybody knows about us.
Yeah, I
Okay.
know.
We'll do an international tour. I love it. Okay. So in particular, I would love to talk to you a lot about the seizures and you're just so many different avenues of questions there. Let's see, right now I'm using the CBD, G, and A right now.
Okay.
And I know that there's probably, as I think you've probably experienced, everybody's a lab rat pretty much at this point in time.
Exactly. And that
Okay.
is what I say to people is that doses are so individual. They're
Yeah.
based on your size, your age, your gender, your metabolism, your health, your mindset, just so many things. And so it really is a trial and error thing until you find the right situation. I think one
Right.
of the big problems with CBD dosing is that the regular dispensaries have not done us a service because they usually have the highest CBD they generally have is 10 milligrams. Now, I found a few places that have higher than that. 10 milligrams is not a therapeutic dose of CBD. So they're taking a gummy and they're thinking, well, that didn't do anything. And so then they give up on the idea of CBD, but really it's about 3 gummies worth that you would need to actually feel the effect. And it becomes cost prohibitive for people too.
Wow. Okay.
There are many ways to get your dosages if you want to talk about that.
Yeah. So I'm going to ask, and just so I can have a baseline here, how much are you giving? How much does your dog weigh? And how much are you giving a day?
Yeah. Okay. He, as a young dog, experienced a tear in his, what would be the equivalent of the ACL in a dog in their back leg, pretty common. And surgery was considered the option. We chose not to do that. And we got an orthopedic brace designed specifically for him that he had to use for a year, and he did. Well, and he tore his other one, so we had to do that on that side too. He's off braces. He's been off of them for years, and I've been using CBD to keep his joints and ligaments and everything going and healthy. I could tell he was getting stiff with it. He's 7.5, primarily German Shepherd, weighs about 120. I started giving him CBD tincture at night so that he could have a better night's sleep and not be uncomfortable. And since he's gotten older and a little stiffer, I still only give him a dose of CBD at night. And he takes about 30 milligrams, which would be an adult dose. So 30 milligrams is your basic therapeutic dose for an adult. For your cat, which is she's probably what, 20 pounds or something?
I'm assuming she's a minimum 12, 10, 12. She could be 15.
Yeah. Of course, her dose will be a little bit less than that. Now, more doesn't hurt them. All it does is relax them and make them want to sleep.
Yeah.
Nobody overdosed on CBD, including animals.
Yeah.
So that adult dose of 30 milligrams is pretty much across the board. And children can take 30 milligrams too. For seizures, they are giving children up to even 500 milligrams of CBD at a time for severe seizures. But you always want to start low, just like with anything, like any medicine, you start with the small dose. For your cat, how are you giving it to your cat?
She's, like I said, she is a medical lab rat. So I have just played around it and I've been documenting all of it. So in addition to getting not only CBD, it's a combination of CBD and G. I was using a lot more A, and then she's also getting some pharmaceuticals, bromide salt, and then a phenobarbital recently. So we're going into an area where her body's tired and breaking down, and she's just becoming too tired to fight. And so the dosages are getting higher and more frequent.
That is the challenge, is finding the correct dosage.
Right.
And
Yeah.
so for individuals, it's very individual and even trickier with animals because you don't get their response. You don't know if they're getting high or if they're like too tired because of the CBD or whatever. So you have to just use your best judgment with that. And that is the harder part with dosing with animals.
Okay, that is such a key point, I think, of this whole conversation, because I feel like that adds so much value to helping people just relax and know it's a process and it's an experiment and it's a very uncharted territory is what I've been saying. And it's what motivated me to do the podcast in the first place, because I'm like, wow, this is so amazing and so unknown at the same time.
Yeah, it is really helping my dog too. He's so frisky and you can tell his legs are in real good shape. And I know it's because of the CBD, the regular CBD dosing that I do for him. He
Wow.
loves it.
How old is your dog?
He's 7.5 and he's big. So he's big.
That seems like actually a small quantity that helps him out.
Yeah.
That's a small dosage.
If he's having if I can tell that he's having a more stiffer, tough day, I'll double dose it. I'll do morning and night.
Interesting. I love that. Okay. So let me just go through my questions now. What is an unexpected area in which you didn't see that your expertise would lead you into?
I didn't know how beneficial that cannabis could be for so many conditions. And it just makes me so happy. People have had their skin conditions heal up. They've had no more nightmares for PTSD. They got rid of their opioids, and there's just so many positive benefits. And that, I guess I didn't expect it to be so successful. The other thing is that as far as people go, my clientele is definitely moving away from smoking, which is, I'm very glad about that. The heat to the throat with smoking is really very dangerous. And in the education process, I'm finding people moving away from smoking and going more for like tinctures or edibles or topicals for relief. And I feel really good about that. I think that's important.
Yeah, my heart fills with joy thinking about how many people you're helping in a natural medicine. It's so beautiful. I've always been that way. And it's just it's almost like magic. Wow, there's almost like a one all for everything out there. It's just getting the right components.
Yeah, and now for me, I am way too sensitive to THC, so I really don't use it because I like to think outside the envelope, which is one thing that I think it does for people, helps you lift out of wherever you might be. But for me, I get lifted too far out.
Yeah.
So use the topicals because they don't have a psychotropic effect. They're really valuable too in relieving acute pain. So I really think the topicals have a place too. And some people just use a topical and that takes care of what they need. To me, it is an amazing herb. And I'm really glad that in Washington State, we have that opportunity to utilize it without fear of the law.
Yes, I just recently learned that we actually are one of the few, right? One of the few states.
Yeah. I think 17 states now that have legalized recreational cannabis.
You said 17.
17.
Wow.
And we're one of the few, though, that allows growing your own medicine, though, which is nice, too.
Oh, yeah, that's right. That is amazing. So I wanted, I guess, to particular hone in on your patients who suffer from seizures and their experience. And I think what would help me is knowing what my cat is experiencing, how it affects the heart and the brain, maybe what organs it's taxing.
I can only speak from personal experience, not that I've had seizures, but friends. And it overactivates the nerve cells to the point that your body becomes just exhausted by when a seizure is occurring. And so afterwards, there's such an extreme exhaustion and just mental wash, I guess you could say, where you can't think or all you can do is sleep. And that can take a while to recover from. So basically, all the nerves of the spinal cord and of the brain are just overstimulated to the point of exhaustion. And so one of the things that CBD does is it relaxes those nerves so that it doesn't go into that synapses where they're just firing too much. That's my understanding of it. That's my understanding, more on a seizure level than really a animal seizure level.
So
Yeah.
you definitely just really get into the fact of just trying to dose people and get their seizures either eliminated or reduced, right? Is there a situation where you've totally eliminated them?
Not that I've totally eliminated. I'd
Uh.
have to say they've figured out what to do for them. Like I said, it goes back to that just trial and error. And I try to make sure that the neurologist is in on it too. And frequently
Yeah.
the neurologist will have a recommendation for dosage, either whether it's a child or an adult recommended dosage. And then if they don't, I have them get back with their neurologist so that they can hone in on what is going to be the appropriate dosage, especially if they happen to be taking like Keppra or some of the other anti-seizure medications
Right.
and don't want to not take those, which I can appreciate.
Yeah.
I work with the physician, particularly the specialist, the neurologist on that. I don't try to make independent decisions about what a patient should do.
I see.
The
Okay.
neurologist in on the picture. Seizures are big. They're not a little thing.
Yeah.
And sure, they affect the heart because the heart has electrical activity. So it's going to affect it because of that reason.
In your understanding in working with not only the pharmaceuticals and the CBD combined, you don't have a personal experience for yourself where they've completely eliminated the seizures from the human body?
Yes, definitely. There are patients that I'm working with who have a neurologist also who have been able to get completely off the seizure meds.
Perfect. That's
Mhm.
key right there. That's a gem. And
Mhm.
then, because this is what my situation is, people who still are taking all the pharmaceuticals and the CBD, have you noticed that the CBD is a key component into helping even with the pharmaceuticals?
I think that's hard for me to be able to say because it's hard to tease out the medication effect versus the CBD effect.
Okay, that's
I,
fair enough. Yeah. My personal experience, I do feel like the CBD does help with the phenobarbital.
uh-huh.
I feel like it just keeps her a little bit more grounded.
Yeah.
And then
Mhm.
you also have the combination of people who maybe have not been able to eliminate it, but keep it at bay. And
Yeah.
okay. And
Mhm.
have you noticed that some of your patients are also like on a schedule with their seizures? I'm experiencing that.
I question them all the time, and most of them seem to know, like whether it's morning or night, that it tends to happen more and like the frequency. They have a general idea. And then there's some patients that it's just random.
Okay.
Maybe they haven't figured it out.
Oh, okay. I'm just curious, what's the most you've ever seen a seizure patient come in to really try to figure the dosage rate out?
Really, not frequently at all,
Okay.
once a year, really. And then in
Okay.
between, they're figuring it out on their own because
I
really
see. Okay.
about have to, I can give you rounded numbers, but
Uh-huh.
really individual.
Personal journey.
Yeah.
Okay.
And, your cat ages, it's possible she will not need as much CBD. I don't know if it's making her sleep all the time. So it's
Yeah.
in an area that I just have my personal experience. And then like the CBD dog biscuits and stuff that they have out there on the market, they are helpful. If they've got, 10 to 30 milligrams of CBD, they are probably helpful. And I've heard a lot of people say that they are helpful for their animals. They're worth looking into. But personally, I would make my own product. And you can get high quality CBD 1,000 milligrams at a time online, really. You just have to investigate and see. I don't really want to endorse any particular place, but I get CBD, full spectrum CBD, which has just a itsy bitsy bit of THC in it. And I make my own tincture using MCT oil, which
Okay.
is the fractionated coconut oil, so it stays liquid. And it's a perfect medium for the CBD to be in. You heat it and then put your powder in there and you've got your tincture. And then I measure it so that I know approximately what my milligrams per ounce is. So that's why when you grow your own flower and then make your own product, it's challenging to say what the milligrams is because unless you have your flower analyzed, which they do analyze that to see what like the THC and the CBD content is, you don't really know if you're making it yourself. Then it is even more experimental.
Yes, 100%. Sure. All right, we're going to go back to the questions that we made for you. Let's see. What is a common myth about your job or field of expertise? I do feel like you've covered that one. Did you want to add anything else to that?
No, I think there
Okay.
just needs to be the awareness that cannabis can be useful without making you high.
Okay. And then let's see. I think we've covered most of the questions. Did you want to share most anything about you and your services and where people could find you?
Sure, I'd be happy to. We're called Elysium Medical. That's ELYSIUM Medical. And we're in Yelm. And if you have a medical condition that would qualify you under the RCWs with the state of Washington, I think I mentioned most of them. You can give a call, and if we can help you out, we'd be happy to. And they would call 360-400-2233 to make an appointment with Sandra. And the main thing we need is medical records and a positive diagnosis that would qualify you. And then that's really all you need. So
Amazing. I appreciate that. Do you feel like there's an area that we didn't cover that you wanted to talk about in particular?
let's see. I think I mentioned that I didn't feel like the 10 milligram CBD edibles are an appropriate dose. So if people have been trying those gummies and not experiencing anything, don't give up and realize that there are options out there that might work better for you.
Do you ever think that the potential of a time released product could be invented?
Then I think you'd be messing around with Mother Nature. And I think that's possible, but they made a drug, a THC drug for PTSD, but called Marinol. But the dosage of the THC is so high, all it did was give everybody headaches. So I think that would be messing around with Mother Nature, and I don't think it's going to be as effective.
Do you think that it will ever be to a point where it's so scientifically researched and developed that there will be like a dosage that is just tested and proved where it's the mystery does?
What do you think when you talk about drugs and medicines? Even that doesn't have a standard dosage. They might have a standard dosage, but it doesn't work for everybody. We're still back to that individual, what works for you kind of thing. Your frustration because you can't talk to your kitty and say, hey, do you like it? Or just have to observe the effects, I guess, and make your decisions on dosage based on that. Really, Corey.
Okay, Deborah, thank you so much.
Okay, and good luck with your kitty cat.
Thank you. Appreciate it. You are lovely. Thank you so much.
Okay, you're sure welcome.
Okay, we'll be in touch very soon. Okay.
All right, bye.